Events like receiving medical attention, getting proper nourishment, and going to a well-equipped school are commonplace for children in the U.S. But in Haiti, the poorest country in the Western Hemisphere, and the third poorest country in the entire world, they are quite the contrary. By helping with schools, conducting extensive health activities and mission trips, FOCAS Ministries, the foundation of Compassionate American Samaritans, a non-denominational evangelical organization, is serving Haiti's poorest children and their families in their most critical needs. FOCAS's health activities include child survival, maternal care, and HIV/AIDS prevention using biblical principles. Mission trips involve crusades, evangelism, pastoral training, construction, and medical teams. God is working in Haiti through FOCAS. More than 2 decades ago, the organization's founder, Dick Taylor, first visited the rugged countryside of Haiti's Mount Mer Rizzo. His heart was forever changed by what he saw and experienced there.
I went on a missions trip, actually my first missions trip, to Haiti. Several of us went, and we had many experiences which were life-changing. But the most dramatic for me was a trip to the top of Mont Marizeau. Very rough 2.5-hour trip. And on top we saw this little school and church. And you say, how can they exist? And we said, we got to help. We've got to help. And that was the beginning. Now, this year we're celebrating the 20th anniversary of FOCAS and our ministry to Haiti.
From Dick's desire to help, FOCAS was formed. The organization's vision and mission became very clear.
Our goal is to see lives transformed by the truth and the power of Jesus Christ. This applies to both Haiti and Cincinnati's inner city. And that's what we're about. That's the passion of this organization.
Through its child survival program, FOCAS concentrates on saving the lives of pregnant women, mothers, and their children from birth through age 5. Helping provide safe deliveries, FOCAS works daily to prevent deaths among babies, infants, and children from such causes as malnutrition, diarrhea, pneumonia, and vaccine-preventable diseases.
HIV/AIDS is very prevalent in the country of Haiti, and what we attempt to do through FOCAS, especially through churches and schools, is to prevent the disease through better education.
Having grown up in Haiti, Gabrielle Vincent, director of FOCAS Haiti programs, is well aware of the challenges that children and their families face.
I want to be the voice of the voiceless, and I joined FOCAS because based on the track record, and when I read about them and I spoke with Dick Taylor and understand his passion, we want people to see in Haiti there is hope. We want to show people around the world all those talents that are being wasted. There are no one to give them direction, to tell them empower and build their capacity. I want to keep those kids out of the street. That's why I involve in this, so I can be part of the solution. I can create something for them so they can live in Haiti with pride and dignity.
The funding for the sponsorship program comes entirely from individuals and churches. When Sherry Spencer learned of the Haiti Child Sponsorship Program during a presentation at her church, she signed up and became a sponsor for a precious little girl named Lunda.
For the $20, that child gets a uniform, they get to attend school, they get books and school supplies and medical attention, and they get a hot meal every school day. This is something most Haitian children only dream of. Sponsoring a child gives a child a chance for a life with a future that has hope, of a different kind of life than they would have if they stayed in their impoverished situation and did not have the opportunity to go to school. It was really exciting to meet her for the first time, and she has 5 brothers, and I think 3 of them are sponsored now. So she needs a couple more sponsors to get all the children going. But she's very excited about going. She does very well in school. She has big plans of being an engineer, and I like to see that come true. I think that's an exciting goal for a child in such an impoverished situation. But she has the chance now.
Dave and Mary Kay Thompson support 4 Haitian children through FOCAS. They are from Springboro, Ohio, and Dave is the chairman of the FOCAS Board of Trustees.
I heard a nurse speak to a group of women. She just returned from Haiti, and we met with some FOCAS people after that, and we just became very interested in going, so we ended up going on a trip to Haiti, and we're able to see the children ourselves and see the work that's being done there, and that really sold us because we saw them being fed and being taught in their little uniforms, and we thought this is where we want to put our money.
For us, less than $1 a day per child. The education is superior quality, healthy food for that one meal that they're getting, and for less than $1 a day, a very small fraction per child was going a long way.
I feel that we were able to make a difference in the life of 4 children, and because we saw it ourselves, and it's an organization that we really trust, and we know the people, and we know that what is being said is really being done because we were there and we saw it. So we thought, what a better way to give.
Part of the sponsorship goes toward medical care, and as well as uniforms. And that is significant because in Haiti, medical care is virtually unavailable. I've had physicians from the United States that I've taken to Haiti that we would walk out of a school and have him say, there are no sick children. That's virtually unheard of in Haiti, that there's so much illness that the children, for the most part, in the FOCAS schools are healthy children.
FOCAS raised the money to build a new, much larger concrete school, which reopened in late 2006. Whether it is sponsoring a child or telling people in your church about FOCAS, you can be part of a team where lives are being changed, one at a time.
We've seen a lot of change in Haiti, change that really makes us feel good. We've seen change, most importantly, in lives given over to Jesus Christ and growing in Jesus Christ. That's number one. But also in education, we've seen hundreds, even thousands of children getting an elementary education and moving on from there. We've got about 600 in the schools right now, and we'd like to see it 6,000. The infant and maternal mortality rates have gone down substantially in the area where we have our health project. And now we're seeing prevention of AIDS through teaching of abstinence and faithfulness. It's wonderful. We've seen change. We'll see more, but the change we've had to date, it really makes us know it's worthwhile.
For over 20 years, through prayer, financial support, and short-term mission trips, individuals, families, and church groups are embracing FOCAS's mission by getting involved and making a difference in Haiti, one life at a time. Do you need a little more assurance?
We know there are many other ministries doing a lot of good things all over the world. But what we know is we're giving an extremely high value per dollar invested in terms of kids getting educated, kids getting a Christian education in a very difficult situation.
FOCAS is a member of the Evangelical Council for Financial Accountability and the Better Business Bureau's Charity Information Network. Will you please help FOCAS make a difference in Haiti, one life at a time, by sponsoring a child in Haiti for $20 a month or making a one-time investment? To learn more about FOCAS Ministries, call toll-free 866-494-2484 or visit www.focus-us.org. Thank you for your desire to make a difference in the life of a child and a nation, one life at a time.
One out of 7 people in the world have no access to clean drinking water. You have clean drinking water. Every child deserves at least that. Who can change this? You can.